class, welcome to Human Diseases 101. Today we're going to be talking about neglected tropical diseases, specifically American Trypanosomiasis. And I would like to remind everybody very quickly that as per the Dean's request, this lecture is not recorded and there are no cell phone use during this time.
So, American Trypanosomiasis is a vector-borne disease, and it is transmitted by the triatomine bug, also known as the kissing bug. The agent that is responsible for the disease itself is the protozoan parasite. And this parasite is called the Trypanosoma cruzi. Okay. Early stages of this disease usually are asymptomatic. And if there are symptoms, they usually consist of headaches, swollen lymph nodes, and swelling of the bite site. The lesion which is left behind from the bite is usually referred to as a chagoma.
All right, and in terms of the life cycle of the disease, there are two stages. There is the bug stage and the human stage. The first stage involves an infected triatomine bug biting a human host. And immediately after biting the host, they defecate on the vector site, which allows the protozoa to enter upon scratching at the site of the bite. After the protozoa enter the host, they target and infiltrate cells, and after they have entered the cell, they multiply and mature through a process called binary fission. Binary fission is an asexual process where the protozoa splits itself in half to create identical versions of itself, and it is a very rapid process. Once there's a large quantity of protozoa inside the cell, they burst out of the cell and they enter the bloodstream. After the protozoa are in the bloodstream, a new triatomine bug bites the host and ingests the protozoa. The protozoa then multiply inside of the triatomine bug, and then they are ready to be excreted again, and then it goes back to the first step where the triatomine bug bites a new human host, and then they defecate on the bite location, and it starts the process all over again.
After about 8 to 12 weeks, this disease progresses to the chronic stage, and more importantly, it becomes incurable. After 10 to 30 years of initial infection, roughly 30% of cases will develop secondary complications. Common secondary complications consist of enlarged ventricles, cardiac arrest, and cardiomyopathy. Less common secondary complications are composed of enlarged esophagus and enlarged colons.
Now on to treatments. There are two medications which are both antiparasitic that are used to combat American Trypanosomiasis. One being benznidazole and the other is nifurtimox. However, due to the disease being asymptomatic in nature, it is best to combat the chronic form of this disease through the use of prevention. Although there is currently no available vaccine for Chagas, vector control measures can be used to reduce the risk of being bitten and acquiring the disease. Examples of these vector control measures can be bed nets, insect repellent, and wearing protective clothing. Early diagnosis of the disease is also crucial for preventing the chronic form, as you can put on the medications mentioned above in order to stop the disease from developing further. You may be wondering why the disease is so persistent. Aside from the high population of triatomine bugs in the areas of the world with higher prevalence of the disease, there are other ways in which one can acquire this disease. Some of these alternatives are vertical transmission. This is when the disease is passed from a mother to her child during the fetal stage of development, blood transfusions, organ transplants, and other surgical procedures, and also consumption of the foods that are transmitted or contaminated with triatomine excrement. Recently, it's also been discovered the disease can be transmitted sexually, and it's important to be aware when traveling if the country you're visiting is known to have a high prevalence of American Trypanosomiasis. Now we're going to pass you on to our friend and epidemiologist Costa. He's here to explain the epidemiology of American Trypanosomiasis.
Hey everybody, so I want to thank your guest lecturers today for introducing me. My name is Costa. I am a epidemiologist from Argentina, and that's why today I kind of want to give you guys kind of more of an inside scoop on the epidemiological characteristics of Chagas disease. So what we want to make very, very known for you guys today is that this disease is very prominent in about 21 Latin American countries worldwide today. And it's recently being introduced to non-endemic countries currently as well. And the reason for that we want to kind of make more apparent is the immigration and traveling. So immigration includes individuals who are from these Latin American countries who are immigrating to the North Americas and bringing the disease with them. And the traveling is kind of us who are tourists who are traveling to these destinations and also bringing the disease back with us. So when we mention prevalence versus incidence, we want to look at prevalence being the existing cases. So about approximately 8 million cases worldwide today of Chagas disease alone. And in terms of incidence, or the new cases, there's approximately 42,000 cases per year worldwide, and 28,000 of these are in the Americas alone. So when we look at current at-risk populations, it's approximately 25 million at-risk populations right now, and the mortality rate is approximately 12,000 deaths per year. So as we carry forward into the global impacts, the annual disease burden worldwide is approximately 627 million USD dollars, which is insane for a neglected tropical disease. When we move into the high prevalence rates, Argentina, the home country, is at 1.5 million. Close by is Brazil at 1.15 million, and Mexico at 875,000. So as your lecturers mentioned already, I kind of want to link back to the persistence of the disease and kind of dive deeper. Access to healthcare is a big one. As I mentioned, we're looking at Latin American countries, some of which are still developing, and what that means is that access to healthcare is a little bit more restricted. As in the Americas, we have a little bit more access to healthcare, and we're better able to treat and manage this disease. Early diagnosis is super important as well. Again, there isn't as much access to healthcare there, so people wouldn't really know if they have the disease or not. It's kind of, you gotta kind of have to wait for the symptoms to appear. And mother-to-child transmission is important as well. Linking back to early diagnosis, the mother doesn't really know, and what she's passing off to her offspring via vertical transmission is unapparent. One of the bigger things that I want to touch upon was the DALY. The DALY is the disability adjusted life years, and what this means in simplistic terms is that approximately 10 years of an individual's lifestyle is kind of, how do I explain this in better terms for you guys? Somebody living with this disease has a kind of negatively influenced lifestyle. So what we want to, how to make this easier for you guys to understand is that 10 years of a person's life living with this disease is essentially minimized. So they kind of, for 10 years, they're essentially suffering, and that's what we kind of want to make apparent with the DALY. Finally, moving into current development, there is a vaccine development currently being talked about, and it's being tested on animals right now. It has been successful, but we haven't really moved to human trials. It's the Trypanosomiasis. And we also want to talk about the immunotherapy of this disease. Right now, this is someone who's suffering from the disease, either acute or chronic, and they're receiving immunotherapy. And the hope is to kind of boost their immune system in a way to kind of prevent the disease from overtaking their life. And that's all. I will pass you guys back off to your guest lecturers, and I want to thank you for having me today.
And this concludes our presentation. We hope that you have taken away a better understanding about Chagas disease, and we hope that you can apply this in your...
Is that a cell phone? You're not supposed to have those in here.